Welcome to 50 Plus in Montgomery County, a monthly program that is a voice for many produced by the Commission on Aging. This show is insightful for people of all ages, and each episode takes a fresh look at important issues by spotlighting older adults in the community, representatives of services and programs, and activities of interest to older adults. My name is Katie, and on this month's show, we're going to talk with Wanneh Dixon. Wanneh Dixon is the program manager with the African American Health Program that is under the Department of Health and Human Services. Wanneh, welcome to the show.
Thank you. Thank you for having me.
I'm so glad to talk to you. Wanneh, tell us a little bit about yourself and what you do.
Well, again, good morning. Thank you for having me on the show. As you said, I am the program manager for the African American Health Program. I've been with DHHS for 1 year and very honored to serve. In my role as program manager, I oversee our strategy, our programs and services, and make sure that the program is responsive to the community needs. Prior to joining the county, I spent almost 20 years working with nonprofits, NGOs, and pharma, supporting the strengthening of health systems and connecting people to care. And that is the work I continue to do today.
Wow, that thread, connecting to people to care, it seems like you've had that throughout most of your career.
Absolutely. That is the most important thing. That is the thing that I'm most concerned about, is connecting people to care in an equitable way, in a way that also addresses disparities and barriers to accessing that care.
Let's keep that as a theme and tell us a little bit about the African American Health Program, also known as AAHP, and how through that program you connect people to care.
So I think what's really unique about AHP and how we connect people to care is we literally meet people where they are. And I don't mean necessarily physically, although we do go into the community and perform our programs and services directly, but also where people are in their health journey. In other words, do you really understand everything about your health? Do you understand how to treat or prevent certain chronic diseases? Are you comfortable with talking to your doctor? Do you have the support that you need, everyday life to make sure that you have healthy outcomes? And so those are the questions that we try to answer. So when we think about connecting people to care and meeting people where they are, it's where are you today in your health journey, and do you have the support that you need? And I think that's really what makes us the most unique, and we do that through our various programs and services and the number of resources that we provide.
Now, making sure that people have low barriers and access to care. It's my understanding that the African American Health Program has been around since 1999. I did a little research and found that out. And considering your programs, you have a number of focus areas. Wanneh, talk a little bit about each focus area.
Absolutely. We do have a number of focus areas, but we take a very integrated approach to how we address certain issues. So our focus areas are maternal health. That is our flagship program, commonly and affectionately known as SMILE, S-M-I-L-E. And so that program is unique in that we provide home visits and telehealth support to moms while they're pregnant, and also for 1 year postpartum to make sure they have the support that they need or supplies they need. While they're pregnant, we do monitor them for social risks or high medical risks. And what I like about the program is I'm seeing more dads participating too. It's really interesting when I go to the graduations and I see the dads holding the babies, because that also impresses the importance of men in parenting, and it's not just on the mothers. Secondly, our largest program would be what's called CDMP, or Chronic Disease Management Program. This program is all-encompassing. We talk about chronic disease screening, but there's also like the weight management program. We've seen amazing results with that. People are losing weight. People are becoming more active. I was even inspired to start losing weight through our own program. There's also the diabetes prevention program, which is also part of CDMP. And that is how we manage, we teach people how to manage diabetes through nutrition and lifestyle. And our DPP program actually has gold status recognition from CDC, and we've had it for a few years, and that's something we're extremely proud of. And it really speaks to our commitment to a consistent program and our commitment to really improving the health outcomes of residents.
Wow. Wow.
Another one of our programs and focus areas is around HIV/AIDS. In Montgomery County, Black women still are experiencing very terrible results when it comes to HIV and AIDS rates. And so our program has moved beyond just testing, which has been the norm for many, many years, testing, but we've also we're connecting people to PrEP and educating them about their options, to be more preventative beyond, condoms and sexual responsibility. We've created a network and a support for those who are using PrEP, or for those who may be positive. There is support available for them throughout their own care journey.
Wow. So Wanneh, I want to just stop you really quick. If you can explain to us what PrEP is for audience members that don't know, and then we'll go back to the other focus areas.
Absolutely. So PrEP is a preventative medication that it's taken orally. Previously, I think people have noticed that PrEP was really geared a lot more towards men, and now we're seeing it shifting more towards women. And when taken properly, it does prevent the transmission of HIV.
Okay, so we've talked about maternal health, chronic disease, HIV/AIDS, and PrEP that you are, making sure that residents have access to. What are the other focus areas?
So another area, collectively, I would say is oral care. Oral health, people think of just the teeth, but there's really a direct connection between chronic disease and oral health. It's really important to maintain oral health, and many people don't realize that there's a connection, but there is a connection between the two, and so we want to make sure that people are aware of that. And also within DHHS right now, there is a pilot program in East County connecting more residents to dental care, and we refer residents to that as well.
Okay.
But we also are working with dental students at the University of Maryland in Shady Grove who also come and do screenings or health screenings for us in partnership with us. Another area that we focus on is sickle cell, which is something that disproportionately affects the Black population.
Right.
And so we are not only talking about awareness, but also supporting our sickle cell families in the county to make sure that they feel supported and they're seen, not only in the hospitals, but also at the county level. And then also there's our cancer awareness. All of our awareness things are really moving past just awareness, but really pushing people towards screening. And that's breast cancer, prostate cancer, for the men and the women respectively. I think a lot of people are aware of colon cancer and how the CDC has recommended a lower age for screening. Previously it was 55 plus, now it's down to 45 plus, and that's because of the prevalence of the rates of colon cancer.
Okay.
So we are sending those kinds of messages out to the community, making sure people understand, making sure people are empowered to take control of their health and know their own information to, again, meet them where they are.
Okay. What about, I know I read something about a seniors corner, weight management, as well as mental health, if you want to.
Yes, absolutely. So our aging, or the seniors corner, very dear and near to my heart. Aging is one of those areas where we talk about social isolation and bringing technology to seniors. We've been talking about brain health and Alzheimer's and dementia. And in fact, we have a conference coming up that is completely focused on the seniors, which I'm really excited about. It's a day for them to come out and have fun. And so we're supporting our aging population, but not just starting at 55. Our approach to aging is, what can you do before then so that you can have a better aging experience, so that you can go into it much stronger, much healthier, and more supported.
I want to ask you this, Wanneh. So what can you do beforehand? Obviously, this show is 50 Plus in Montgomery County, produced by the Commission on Aging, that focuses a lot on resources for that demographic in the county. So what types of information do you share with that population that they can do beforehand?
So one of our big focuses is on brain health, keeping the brain strong and sharp cognitively, by doing brain exercises, crosswords, word puzzles, anything that gets the brain, just keeping the brain active. Having strong brain health, could essentially reduce the incidence of Alzheimer's and dementia. Essentially, that is our hypothesis that we're working with, but also focusing on the caregiver aspect of aging.
Okay.
We want people to age in place and age where they are comfortably, but for those who have caregivers also need support and need to understand what our seniors need as well. So we do focus on their support, making sure that they understand how to be supportive and how to show up. Social isolation, as I mentioned before with chronic disease, some of that, if you're not well, you will unintentionally begin to isolate yourself, either because maybe you're feeling depressed, which is the mental health aspect of it, or maybe you don't know where to get help, or maybe it's expensive, or maybe there's a transportation issue, all of those things. So we want to address the social aspects as well. as people are getting older, because I think finance is a huge worry for us as we get older. Our children, our extended family don't want to be a burden. So we really want to put in place that notion of community, establishing the community, establishing your village, creating your network and your connections, so that as you age, you don't have to do it alone.
Okay.
And through all of that, just letting people know AAHP is here, and we will help direct and guide you. And we've created a few toolkits, like 3 toolkits, I think. 3, and there's a 4th one coming out soon, to provide that kind of information.
Yeah. So Wanneh, what you're saying is I have games on my my mobile device. It's okay that I play those games. It's helping my brain health.
Yes,
okay.
absolutely, absolutely. You can get lost in all of it. It all serves a purpose. I'm not saying I'm not saying do it at work, but
yes.
or
it's
when
okay
you're driving.
To partake.
Yeah, don't do it when you're driving. But absolutely, all those things help.
All right. Well, I definitely want to ask this question. So based on what you just talked about with the focus areas, how else are you making a difference in Montgomery County by equipping residents with the tools and resources and the knowledge to help them adopt healthy lifestyles?
So I think that the best way to answer that question is through our approach, which is the culturally responsive approach. I think it's very important to take into account those nuances of culture that drive your decisions around lifestyle, nutrition. Do you see the doctor? Do you talk to your family about what's going on? And it also impacts how and where you receive information. If you're someone that's online on social media, there are certain sites that you'll be going to versus others. And we know the social media is a big place, but really keeping at the center that cultural aspect and acknowledging that, in addition to lived experience, is how we make a difference, because we tailor everything around that. We really are, I think, respectful and humble, and a lot of our program staff, they live in the county, which also makes a difference. I live in the county. I have for almost 10 years.
Okay.
I love Montgomery County,
Me
and
too.
I'm very proud to support it and be a part of this.
Yes.
And so I think all of that energy too, in addition to what we do, how we do it, and who is doing it, really makes a difference.
Okay.
And that connection. People trust us, they know us, they see us. It's been 25 years, 26 years.
Yeah, to be a trusted messenger in community definitely helps. So another thing, I read one of your recent annual reports, and it just really highlighted the expanded efforts across like multiple areas, the health disparities that you mentioned, the focus areas. But when we think about the focus areas, which ones have seen the most success that you've identified in that annual report?
There's been success across all the areas.
Okay.
But I will say the one that has probably stood out to me the most recently has been in the weight management program.
Okay.
I have heard stories about, in fact, I heard someone that, the recommendation is to move 150 minutes per week. I don't know about you, but I don't do that.
Okay.
I do a lot of sitting at my desk.
Okay.
I try to fit in 15 minutes a day, and then I'm like, whoo, I got 15 minutes in. I heard about someone that got in almost 600 minutes of physical activity. There's been high results of people losing weight. And it's not just about losing the weight, it's about changing lifestyle and changing nutrition and what they're learning through our nutrition classes. And all of that leads to better outcomes and lower incidences of diabetes. It leads to lower incidences of cardiovascular issues. All of it is related. So I think the success is starting with the root cause and not so much focusing on like the solution. Instead of saying, oh, we want to reduce chronic disease by X%, what we're saying is we want to get people to exercise more, to make better food choices, and to also provide pathways to accessing better nutrition, through local farmers markets and local partnerships. All those things make a difference, So that is one thing I'm really, really proud of, and also with our, as I mentioned, our gold recognition. I think that's really important.
Yeah, with the CDC.
And then the second piece, and this may go hand in hand, is with our maternal health program. We don't have a lot of incidences of low birth weight, which is what we want. We want babies to be born at a regular birth weight, not a low birth weight. We've seen great success in that area, and that's probably because of the consistent monitoring and the two-way communication that's happening between moms and the nurses, and they stay with us for a year after. which speaks a lot to how they feel about the program and how they see the value, in the program. We have success across all areas.
Okay.
I think we've made incredible gains across all areas, and as we continue to respond to rapidly changing community needs, we'll just continue to achieve the success that we're looking for.
Okay, well, there are a lot of needs in this county, and they are rapidly changing.
Yes.
Keeping that in mind, partnerships and community engagement are emphasized in that report.
Yes.
Can you share some examples of community partnerships that have significantly impacted your programs, the outcomes, positive outcomes, and then the lessons that you've learned?
Yeah, we have a number of partnerships. We have partnerships with hospitals and also with some of the local clinics. But I think the more interesting partnerships are the ones where we think outside of the box, where they don't necessarily see the connection to health. So for instance, HOC, the Housing Opportunities Commission, they have a fatherhood program that we also participate in. And our role is to provide screenings, for cancer and also mental health support, and some of the parenting classes. And so what's interesting about this partnership is we've conducted about 200 screenings. We've been in partnership since 2021. So we've conducted about 200 screenings, reached about 500 men, and each cohort is getting larger and larger and larger.
Okay.
And one of the things that we've learned through this partnership is, one, diversifying partnerships is important. It's extremely important. Thinking beyond the hospital. In fact, PNC is also a partner in this. They are providing financial literacy. And these are young men in the program who are, they're non-custodial parents and they're low income. So that is a huge piece of, something that we can address, right there. And because we talk about parenting, we also talk about the moms a lot, but this is focusing on young men, and instilling them with the tools they need to be the present fathers they want to be the better fathers they want to be, not just now, but going on long term. I think that program has had amazing, amazing outcomes, and they've asked us every year to come back and be a partner. And actually in June, there's a Father's Day event in partnership with them that's taking place in Wheaton Regional Park that we're looking forward to. So there's the need. I think another partnership is with the Howard University Gerontology Center. We are partnering with them on our social isolation efforts. And this one's interesting because it's in DC, but it's also historically Black, college university. So this is that cultural piece that I was talking about, that community piece that I was talking about. And we're in Montgomery County, but we're also part of the DMV, right? M could very easily stand for Montgomery County and DMV. People work here and live in DC, or they, how we are in this particular area. And so with the Gerontology Center support and their insight and the guidance, that is helping us to shape our social isolation program, taking what they've done in DC and tailoring it more so for Montgomery County. And as we develop the resources that we share, who do we talk to, who are the experts, how do we bring people together, what have we learned? We can reach across our DMV brothers and sisters, and create something that is beneficial for residents in the county. We also have partnerships with small businesses that provide some of our direct services. I think that is so important to uplift small businesses and invest in small businesses. Yes, we are the African American Health Program, but we don't do all of this by ourselves. We couldn't do all of the classes that we do without our small business partners. We couldn't do a lot of the outreach and engagement that we do without our business partners. It is really a joint effort, and everybody's contributing to our long-term mission and goals.
Wow. You mentioned Howard University, which is an HBCU. I think earlier in the conversation you also mentioned the University of Maryland, which is a PWI. So that's the diversity right there.
Absolutely.
Those different institutions, but doing very much similar work.
Absolutely. Yep.
You mentioned your upcoming event in June. What other upcoming events does the African American Health Program have coming up?
Oh, we have so many. We are so busy. So March 23rd, as I mentioned, will be our Senior Social Connection Day, which I'm looking forward to. Because I went to an event in December with the seniors and they showed out. They had such a great time. They were dressed up and
Yes, yes,
dancing
yes.
and socializing,
Yes, yes,
and it was really amazing to see that. And so we're hoping to create something similar in the spring. You know, it's called the senior social event, but in our minds, it's like we've been dealing with a rough winter. Let's give everybody a reason to come out, brush off the snow. Let's enjoy some beautiful weather and come and socialize and have fun and make those connections, but also learn at the same time.
Is it like a daytime event or evening event?
It's a daytime event.
Okay.
It's at the Silver Spring Civic Center.
Okay.
It's from 9 to 3.
Okay.
So the first hour we'll just kind of be talking about the resources that are in the county and how people can sign up and get connected, and we'll have vendors there. I'm still
some of those small businesses that you
some of the small businesses, small and large. I'm still in conversations with a few, and you know, and so we have like the new toolkit that's coming out about social isolation. They're going to be brain activities and exercises to get people moving, and it's going to be a really great day. Really great day. And then in April, it is National Public Health Week, so we'll have a number of events during National Public Health Week, focusing on awareness and education, and again connecting people to care. And then there's Black Maternal Health Week. We are planning some things. That is the following week after National Public Health Week, which is, I guess that will be the third week in April. We have some things planned for Black Maternal Health Week from our SMILE program. You know, connecting moms to better nutrition is what we'll be talking about, holding a few conversations and workshops. And then in May, we've got a lot going on. We are busy. We are busy. So in addition to the large events, we also have like our ongoing monthly classes that people can sign up for. They're free. There are no less than 10 classes every month, a great variety. There's something for everybody. You know, a lot of great things coming up.
Wanneh, what type of classes do you offer? Like what do they cover?
Nutrition. There's cooking demonstrations and like recipes. There's also lifestyle. There's a yoga class, and I haven't been to that one yet, but I've heard it's fantastic. There's mindfulness. There's mindfulness and mental health support. There's also some private support groups where people can come together and talk and share. In addition, there are oh gosh, I said lifestyle, so that's our diabetes, that takes care of diabetes. I think that's the gamut of our classes. Okay,
I have two more questions. I hope we have time for them. But just kind of looking ahead at AAHP's future. Clearly you've been around since 1999. You're going to be around for the foreseeable future. How else are you creating culturally responsive outreach strategies that promote health equity?
So taking advantage of technology, you know, but not letting technology be the driver. There has to be a balance, right? And so I think everyone is aware of AI. AI is everywhere.
It is.
You know? And AI can be a wonderful tool.
Yes.
It can help us with like predictive analytics to help us show us where we are versus where we are not. Where are we meeting needs, where we are not. It can be a wonderful tool for that. It can also be a tool for connection. You know, whether you access AI directly or not, you're using it.
We all do.
We all do. Whether we, you know, and so it is a great digital support, you know, but we also know that not everybody is technically savvy, and there are going to be some people that need to catch up. So in addition to our technology through like QR codes, which, you know, for those who just take a quick picture, you go straight where you need to, you know, don't have to deal with the website. QR codes are great, you know, and if you go on the website enough, it will then start suggesting things for you. You know, but for those who are not as technically savvy, you know, we are reaching them in a different way with physical copies of toolkits, physical copies of brochures and flyers. You know, again, it's about meeting people where they are and understanding how they access information and how they're comfortable not only accessing information but retaining the information and using the information. We want to give it to you. We want you to use it. You know, we want you to sign up. We want you to stay engaged with AAHP. You know, we do that through our pictures and like where we are. We have a lot of relationships with barbershops and churches and community centers. That is where we engage with the community, outside of like our home visits where we're in the home.
Yes.
But that is we go to where the center of culture is and where people gather.
Okay.
To deliver that information.
All right. Well, Wanneh, I only have 1 minute left.
Okay.
How can we stay in contact with the African American Health Program? And I also want to plug perhaps artificial intelligence, how to use it responsibly, could be a topic of discussion for one of your classes. But how can we, do you have a newsletter? How can we stay in contact?
Yes, we do have a newsletter. It's called Health Notes. The way to get in contact with us is go to the website, AAHP
Okay.
When you go to the website, you will it will ask you to sign up, and that is where you put your name and information. We don't do anything with it except put you on our mailing list, and that will get you connected to the newsletter. There's also a calendar of events that is on the website as well. We are also on socials, Facebook, Instagram, so you can find us there, and Twitter. And if you're into the old-fashioned way, you can call us.
Okay.
240-777-1833.
Okay.
There is somebody that's answering. It will not be a chat. It will not be a chat bot. It will be a live person answering, and she is fantastic, and she will answer all of your questions and direct you where you want to go. I
know that people will appreciate that. Well, thanks for having this conversation with me today. Well, that concludes our program.
Thank you for having me.
Absolutely.
Thank you so much.
As you can see, the voices of those 50 plus matter every day and in every way. To learn more about services for older adults in Montgomery County, please visit the Montgomery County Seniors website by visiting montgomerycountymd.gov/senior or call the Senior Resource Line at 240-777-3000. And as always, thank you for watching 50 Plus in Montgomery County.